Okay, so this is Brian Emmerich. He is our ICU clinical pharmacist. He has been here the longest out of all the clinical pharmacists, I think now. You're like the grandfather.
Yeah.
Or should we call you the godfather?
A little bit.
A little bit of both. So I'm going to have him kind of tell you what it's like in a day of the life of his rotation, because he has been here, again, the longest and has probably one of the most integrated practices on the Boswell site. Okay, go ahead, Brian.
So I've been here for about 15 years. In 2010, we started a intensivist program down in the ICU. We're primarily a medical/surgical ICU. On one hand, we see a bunch of medical patients. For two of our units, we have 1A and 1B, which are all medical patients. And then on 1C, we have our cardiothoracic program, which is a pretty extensive program for cardiothoracic surgery. The intensivists that we have now, we have 4 main intensivists that we round with. We do that every day at 10 o'clock. From 10 to 11, we'll go through patient cases, determine DVT prophylaxis, stress loss prophylaxis, make sure patients are on the right antibiotics. Then throughout the day, we'll be going over things like kinetic consults, discern alerts, making sure that patient sedation is appropriate given whatever their conditions are. We go through things like making sure the patient is synchronized with the vent, so we'll make sure they're on the appropriate amount of neuromuscular blocking agents and making sure that's monitored properly. The residents will be responsible for following anywhere between 3 to 15 patients, depending upon how comfortable that resident is with following cases. And obviously, when a resident's new, they may only be able to follow, 1 or 2 patients to start out with, and then we'll try to build on that throughout the 6-week rotation.
Awesome. So how is their experience with, that sounds like a lot of good rounding and some good chart reviews and that sort of thing. So how about the code situation and your COVID situation that you've been working with?
Sure. So with regards to
Always busy.
With regards to code situations, usually the residents will have their ACLS, and so if they are interested in, they can be as active as they want, or they could just participate with medication administration and helping out with running the code cart, or they can jump on and start doing compressions depending upon their comfort level.
That's awesome.
And then with regards to COVID, we
I'm
had
just gonna pan our room here to show.
over 50 beds of critically ill patients with COVID. It was kind of like a war zone here, so it was pretty intense.
Yeah.
We had a lot of patients, and as you know, there's not a lot of really good treatments for them, but we did the best we can with what we had.
Pretty awesome. So you've worked here for 15 years. Have you been a clinical pharmacist for 15 years or longer than that?
16 years.
16 years.
Yeah.
Okay, and how much precepting experience do you have?
For the 15, well, I guess
For
the 16,
forever.
yeah. It was like forever.
And that's with students and residents, right?
Yeah, so Preceptor for University of Arizona for Midwestern, and then there were some other Midwestern states, Midwest states that I was also Preceptor for.
Awesome. And then one last question for you.
Yeah.
Where did you get that scar on your nose?
From jiu-jitsu.
What was that?
Jiu-jitsu.
Yeah, we've got an ICU pharmacist that does jiu-jitsu, so it's pretty awesome.